When I was 19 years old, I was dead set on two things: computer programming and becoming a physician. I had spent every non-school hour since the age of 12 programming computers, hacking computers. I even started a company with my best friend making computer games. My undergraduate major was computer science. But I was also pre-med because I had seen firsthand how medicine could impact and improve lives, and I wanted to be part of that. Apparently, in the mid-1980s, I was the only one who thought that was possible. Faculty, my teachers, they all tried to talk me out of it. What could a doctor possibly need with computer skills? My pre-med advisor clued me in. She said, "Raj, no medical school will take a risk on you." And my heart sank. I partly understood in medical education, we ask students to commit 12 years, at least, to their core training. And I was being asked to commit to medicine alone, and to commit to it early. Commitment takes a lot. And it was really too much for me to give up my dreams at that time. But I felt like I needed to. Well, fast forward, and now I'm on the other side with a great team of leaders at Michigan helping to shape medical education. And you know what? The students that we get applying to our medical schools and medical schools across the country are looking a lot more like I did back then. The number of applicants with non-biological science backgrounds is climbing nationally. At Michigan, it's big. 40% of our current incoming class comes from a background not in biological science. 13% of our current first-year medical students are engineers. And they're also coming to us having already completed early careers in journalism, in public policy, in business, in performing arts, impactful careers where they've developed socially responsible health media companies, or they've served as the leader in a community tackling urban blight, or they've invented a device that transmits health data from the remotest regions of the globe. Impact, where they are changing and improving health. And then they decide to go to medical school. So what is the effect of this? Well, at Michigan, the median age of our incoming medical students this year is approaching 25 years old. Think about that, 25 years old. And that trend is reflected nationally. Now add 12 years of core training to that, and these same students will be in their late 30s before they can take all of these skills and knowledge from their professional training and start to improve health again. This is not really creating an age gap as much as it's creating an impact gap. What we are doing as a profession is systematically removing people from what should be some of the most productive and impactful years of their career and taking them out and asking them to delay the possible improvements that they can make to society right now and simultaneously delay their passion. Now, we could shorten training in order to be able to get these doctors out there faster, and some of my colleagues are tackling this very daunting task in highly creative ways. But for many medical students, I'm just not sure that the goal of medical school is to finish and move on. So at Michigan, we are reorganizing our medical education program to be a kind of impact accelerator. In essence, we are taking these medical students and stating that you must be a change agent in society while you are here and after you graduate. And in order to do that, every graduate at the University of Michigan must be able to lead, every single one. Now, I'm not talking about leadership in the traditional sense, like running a corporation or being a CEO of a big clinic or a hospital, or even being at the top of the organizational pyramid. We're defining leadership fundamentally differently. We're stating that everyone must lead by being able to work in a team, by knowing when to lead and when to follow, by being able to communicate effectively at multiple different levels across many different stakeholders, by being a complex problem solver, and by being able to work within systems to impact change. And they must demonstrate these capabilities in real settings while they're with us in medical school. In other words, they must learn how to have an impact, but they also must have an impact while they're learning how. That is the new core at Michigan, which is just one of the 11 schools that are part of this consortium that the AMA has put together to change medical education. Really, this multi-million-dollar jumpstart. And while change and impact are really new to educational programs, what we all are doing, essentially, is liberating us from the structure of the old curriculum and the shackles and the anchor and the weighting that it puts on us, so that we all can try to define this new core. See if any of this sounds like the medical school you went to or a medical school you know of. At Michigan, our students get together in the first month and are assigned to their small groups that they will follow for the next 4 years. But what they do in that first month is develop a mission statement and a vision statement, much like a small business would. They are immersed in the clinical environment from day one, not year 3, from day 1, so that they can experience how patients experience the system, and so that they can be critical observers of how teams, both functional and dysfunctional teams, come together to provide patient care. They are using improvisational acting techniques in order to enhance their sensitivity so that they can be better communicators with each other and, most importantly, with their patients. They are becoming experts in lean thinking and critical problem solving, and they're practicing it with other students from the other 7 health professional schools at Michigan as they come together to tackle problems like, how do I discharge a patient home from the nursing home? How do I prescribe a new medication when the patient's already on 10 others? And how do I manage complex chronic conditions as a team? Now, this is just the foundation of our leadership development program, and honestly, it's just part of what they are going through, because in parallel, they are all on a journey towards impact. Our Paths of Excellence program is fostering real experiential projects that our students lead, working with a team of advisors and faculty members and other students who share this passion that they have. This is not just some sort of classroom concept. These students work in teams and they must develop, implement, and disseminate their project, all of which must have an impact on health while they're in school so that they will be best able to lead change after they graduate. Now, these projects are highly variable and varied and interdisciplinary, but they are all unified by one concept. The student gets a chance to bring their leadership skills to bear. The first wave of our students to try this are now just graduating. And if you want to see what an engineer or a journalist or a biochemist can do while they're in medical school, let me give you a few examples. They have launched a startup company that uses drones to deliver medical supplies to places that can't get them in North America and in Africa. They have launched an NGO that delivers eyeglass wearers to patients in Detroit and in China who cannot afford them. They have invented wearable technology in the form of a vest that transmits breath sounds at a distance so that a patient with cystic fibrosis in the Upper Peninsula of Michigan can still be evaluated by their physician in Ann Arbor without leaving her house. They've genetically re-engineered the organism that causes tuberculosis and has used its mechanism of resistance against itself as a systematic destructive force. And they are using social media as a education blitz in a school-based clinic in order to improve adolescent vaccination rates. And they're doing all of these as team members, working across different constituencies, communicating across different stakeholders, solving problems and leveraging systems. And they're doing it within a community of like-minded advisors and passionate students. Now that sounds like leadership and impact to me. Imagine what these students will do when they leave medical school and become residents and go on to be practicing physicians. Now again, we are just one of these 11 schools that are trying to transform medical education. But we are not just experimenting. We are making this process systematic, measurable, and shareable, all united in this pursuit of the new core. Because it turns out that medical schools need to work in teams too. So as you can see, I actually did become a doctor. And just as a very few number of medical schools took a risk on me way back then, I really think we all need to start taking risks on these motivated, passionate, and impact potential students, and also take risks on these highly innovative programs. Because way back then, all I could conceive of myself being was a computer hacker. But as you can see now, I'm actually an education hacker. And I'm doing it with a great team of innovators at Michigan and really across the consortium. Because honestly, I have no idea where our motivated medical students will eventually end up. But I do know that each one of them will have an impact. And that's just the kind of change that we need. Thank you.